Welcome, everyone. And while everyone gets entered into the room and situated, I want to thank you for joining us for One Mind at Work's webinar on what happens to workforce mental health when you add diversity, equity, inclusion, and belonging to the mix. I'm Dr. David Ballard. I'm Senior Scientist at One Mind at Work, and I'm the Scientific Director for the Mental Health at Work Index. So today we're going to highlight some key findings on the topic from the fall index brief that we recently released. And I'm going to sit down with two leaders who are taking steps to align the initiatives in their organizations so that their people and their companies can thrive. But first, let's get to these ribbons here. This is a piece by Brazilian artist Giovanni Neuenschwander titled, "I Wish, Your Wish." And for the installation, she collected wishes of all different types from people all over the world, and she printed them on these silk ribbons. There were more than 10,000 of these placed around the room, and visitors were invited to pluck one that resonated with them from the wall and tie that ribbon around their wrist and actually take it with them when they left the exhibit. But the catch was, in exchange, they had to write another wish of their own on a scroll of paper. They had to roll it up and place it in the hole where they had taken the other wish from. And those eventually got printed on new ribbons and they added it to the wall. So from these widely diverse set of wishes, all of the visitors to this gallery found some commonality. They found some shared experience. They were no longer alone in whatever they were wanting or whatever it was that they needed. And they also made their own unique contribution to this piece by adding something that would later make its way to another visitor and find common ground tied around their wrist and then taken out into the world of someone else. So it was an ongoing cycle that really reflected diversity, equity, inclusion, and belonging, where everyone found connection. They participated in some way. They took the experience with them beyond the walls of the gallery, and then they contributed to something larger than themselves. So as I was thinking about this exhibit, it struck me as a fantastic parallel to the workplace, which is another environment that brings people together from diverse backgrounds, people who might not otherwise interact with each other. And I thought it was a good metaphor to start us out here today. But I'll leave enough alone with my arts meanderings. But before I introduce my guests, a few housekeeping items. This session is being recorded, and we will share the recording in the next few days. We'll also reserve some time at the end for some Q&A from those of you who are attending. Now, please be sure to enter those questions for our guests today in the Q&A feature on Zoom. Don't put it in the chat because we might miss it. So drop it in the Q&A functions to submit your questions, and we'll have time for some of those at the end. Now, with that, I'd like to welcome our two panelists, Ryan Sledge, who's the Vice President of Workforce Health and Safety at HCA Healthcare, and Beth Wiesendanger, Senior Manager of Diversity, Equity, Inclusion, and Accessibility at ETSI. Welcome, Ryan. Welcome, Beth.
Thanks for having us.
Yeah,
So just to get us started out, I wonder if you could give us just a couple sentences talking about your background, what got you to your current position and the work that you're doing now. Why don't we start with you, Ryan?
Yeah, thanks, David. Happy to. Ryan Sledge, again, Vice President, Workforce Health and Safety here at HCA Healthcare. I've been at HCA for almost 4 years. My background is in public health. And here I apply that to how we care for our employee population, about 300,000 employees across our workforce. My experience in my career has always been in healthcare settings, always public health-based work. And it's really interesting, I think, especially in recent years, this intersection between where public health principles, where mental health, where DEIB all come together in the workplace. And so there's been this natural progression of bringing it together in the roles that I've had. And so really interested in this conversation today and how we can dive a little bit deeper into the integration between those pieces.
Thanks, Ryan. Beth?
Yeah, hi everyone. My name is Beth Wiesendanger. My pronouns are she, her. I'm the Senior Manager of DEI at ETSI. And it's hard to sum it up in a couple sentences, David, but to answer your question of what is my why am I here? I'm a double amputee and a prosthetic user. Grew up in a very small town, very small suburb. Nobody in my family was disabled. Nobody in my school was disabled. And so accessing community became very, very important to me. So I feel very fortunate that I was able to find other disabled people. It was this very light bulb moment for me that often the things about ourselves that make us unique are actually the things that help us bring really diverse perspectives and new ideas to the table. So it became really my life's passion to create that space for others. I started in the world of nonprofit, really doing progressive community organizing and outreach for different organizations like the Planned Parenthood Action Fund, the ACLU, UNICEF, the Nature Conservancy. And then I got really interested in the idea of culture building internally. So pivoted into human resources for quite a while through Target, focused on CSR, inclusion training, belonging, employee resource groups, and then in 2016 made the move into tech. So I've been in tech for quite a few years. I've been at Etsy for about 4 years, and I really oversee our approach to how we not only have employees come to the company, but really how they stay and thrive here at Etsy.
Thanks, Beth. And thanks to both of you for joining us and spending some time with us today. For those on the webinar, you can see the rich experience and backgrounds that we have here. The biggest challenge is going to be paring it down. And the conversations that we had in the lead up to the webinar, we decided we could do this for hours. So if you all have a while to stick around, we really will not keep you past time. So let's dive in because we do have a lot to cover. In our Mental Health at Work Index findings, it's really clear that senior leaders are committed both to diversity, equity, inclusion, and belonging, and to mental health. Between 7 out of 10 to 8 out of 10 senior leaders say, yes, we're committed to these things, and they are priorities for us. So in your own organizations at HCA and at Etsy, why are mental health and diversity, equity, inclusion, and belonging important to the organization? And do you all tie it to particular people outcomes and or business outcomes? Beth, why don't we start with you?
Yeah, it's a great question. And for us, it's very easy to articulate the direct line. Our mission at Etsy is to keep commerce human. So staying human is really core to who we are. And this extends to our internal approach to our people strategy. So our diversity, equity, and inclusion work is really to make Etsy a place where people from all backgrounds can come, stay, and thrive. And part of thriving is being able to show up at work in a way that allows you to be your most authentic and productive self, right? So our work directly contributes to the engagement, the retention, and the development of our people. And our approach to mental health is really a part of that. So we believe that providing mental health resources and support really allows our people to be fully engaged, to be more productive, and also more committed to delivering on our mission.
Great. Ryan, how about at HCA? Why are these priorities?
Yeah, and I think Beth stated it so well for her organization. And though we're different industries, I would say similar concepts around we think about the core of who we are and what our mission really calls us to do. So DEIB and mental health are both at the core of who we are as an organization. Our mission is above all else, we're committed to the care and improvement of human life. And so that really represents health in all domains. We think about it certainly is how we provide healthcare services, including mental health care to our patients. But we recognize that it's also important for us to do that for our own colleagues, our own team members as well. And so that's enabled in our organization, as well as many others, I think, by a culture that supports diversity, equity, and inclusion and belonging. And it impacts our people outcomes in terms of trust, in terms of belonging, retention. I think Beth talked about really wanting to make sure people stay with the organization when they're here. And then for us, business outcomes as well. But when you consider us in healthcare, a business outcome means how well we're taking care of our patients. And that's really important. That's really impactful for us. And so we think it's central to that strategy.
Yeah, for both of you, I want to come back later to talk about some of those other stakeholder groups because you're both thinking beyond just your employee population. So, there's this commitment from leadership. There's commitment from the organization to pay attention to this. But despite the commitment, we found in our results that less than 1 out of 3 organizations that have completed the index have taken steps to align these efforts across what they're doing in mental health and what they're doing in DEIB. So can you all give some concrete examples of steps you're taking to make those two types of initiatives work together? How do you cross-fertilize across different programs and groups? How do they interact with each other so that they're actually working together instead of off in their own silos? And Ryan, you want to kick that one off?
When we think about our mental health efforts specifically, it's certainly been a collaborative effort with lots of stakeholders, as you kind of mentioned, representing different areas of the company. And we think about that intersection with DEIB. I mean, that team has been a critical piece of the work. So not only are they the sponsors and leaders of our ERGs, which we call colleague networks within HCA Healthcare, but they also help us to keep a lens from any of the programming that we're doing around equity for our offerings and help us remove bias and provide opportunities for everyone. So when we think about what that cross-functional team looks like, when we're developing our programming and figuring out what we need to do for our colleagues, from a mental health perspective, certainly there's groups that you would think about like the benefits teams and EAP is well represented. My team, Workforce Health and Safety, our ethics and compliance team, and others are there. But DEI, along with other pieces of the company that kind of represent different segments of our employed population, are really at the forefront helping drive the strategy. And I think that's how we tie those pieces together to make sure it's not an afterthought at the back end, but right up front when we're considering where we're going and what we're doing, there's a prominent seat at the table.
Great, thanks. Beth, how do you align those initiatives at Etsy?
Yeah, Ryan, I really liked what you said about providing equitable access to opportunity because that's really our goal as well. And we found that our diversity, equity, and inclusion efforts really work best when they're embedded throughout the organization. So, like you said, we're not sort of a nice to have or an afterthought, but really in the genesis of how we think about our processes and our programs. The DEI team is brought along and is really foundational to how we're thinking about creating that equitable access. And mental health is a really key part of our DEI strategy. So, for example, our employee resource group program at Etsy, our ERG program, is very robust. We have 10 employee resource groups. And one of our largest ERGs is our mental health ERG, which has dedicated resourcing and executive sponsorship, which is really, really, really crucial. And then the DEI team and our benefits team also work really closely together and how we can evaluate consistently our policies around mental health for our employees. So for example, Etsy provides unlimited sick and mental health days to our employees. We also have access to therapy via our partnership with Lyra, which is really wonderful, and access to mindfulness apps like Headspace. So we're really working closely across teams to understand not only how we can provide that grassroots level support, but also systemically across the organization and understand how people are leveraging and accessing those resources to make sure that we're promoting them well across the organization.
So I was going to ask about this later, but since you brought it up, you both use employee resource groups or colleague networks, Ryan, as you said, you call them. So can you talk concretely about like how do these work? How are they set up? Who oversees them? How do you get input and feedback? And how do they collaborate with each other?
Yeah, so I'm happy to start there. And so our colleague networks, as you mentioned, are our ERGs. So they're employee-led groups that convene groups of our employees together on some sort of shared commonality or experience. And the goal is to drive more diversity and inclusiveness within our workplace. So we've got our Black colleague network, our Hispanic, women's, veterans. We also have a mental health and wellness colleague network, which it's one of our largest and it's certainly our fastest growing within the company. And so Beth talked about sponsorship as a piece of how those networks are set up, and that's critical for us too. We have executive sponsors over all of the networks where there are executives in the company who are leading the charge on one of the networks, whether they feel they identify with that specific network or they're an ally or members in that network. And then a chair to kind of lead the work. And then as we drill down in each of our regions or what we call divisions, there is a similar model. There's a local chair and a local sponsor to make sure that we can also meet the needs specifically for that area, as some of the needs just may be different in different areas. And so we utilize those groups in that way. There's a great opportunity for us to be able to get feedback from our colleagues directly on what's happening, what are their needs, how can we better support them. But then there's also an opportunity to work across those networks and ensure that we're partnering on initiatives too. Because it's our belief that when we do that and we create this environment that's more inclusive overall, that's better than for everyone. And so that's really the goal of our colleague network.
Yeah, it's interesting to see that both of you have specific mental health focused groups, which is exciting to see. So, Beth, practically speaking, how do your ERGs work at Etsy?
Yeah, so we have a very formal support structure for our ERGs. Each ERG has a dedicated leadership team that's elected on an annual basis that consists of co-chairs and co-leads. We also, all of our ERGs receive dedicated budget, which is really important. They all have executive sponsorship, Ryan, as you mentioned, as well as training for our ERG leaders. And we also have a dedicated ERG program manager who works across all of our ERG leadership teams to provide organizational support and really connect those dots. And we're able to work with our ERGs and partner them with, our HR team, our learning and development team, our benefits team to up-level their voices in the feedback from those communities. An example of this is our mental health ERG, and those leaders were really instrumental in us partnering with Lyra as a partner. And because they provided us feedback that they really wanted therapy coverage for dependents as well. So their feedback has really allowed us to create new offerings that feel really specific to the needs of our community. And then our mental health ERG, all of our ERGs work really intersectionally as well across our spaces to provide resources, awareness, and education around mental health within specific communities. So, for example, our mental health ERG is partnered with our Queer at Etsy ERG to discuss mental health and orientation. And they've also partnered with our parents community, mental health and parenting, and with our Black identity community around race and mental health. So we've been able to really curate resources and support for very specific intersections of our community. And we've also been able to work with ERG leaders to tweak our benefits, increase our benefits, and also provide educational resources for managers as well.
If I can just highlight
Oh, yeah.
one of the things there, if I could, that Beth
Sure.
said that I thought was so powerful, and it is around having the dedicated budget for these groups as well. And I've seen sometimes where that is not the case, and I think just having that makes such an impact. And we're fortunate to be able to have that within our organization as well. She talked about piloting some initiatives. Our mental health and wellness colleague network was able to pilot an initiative around being peer support for mental health. Those sorts of things take funding to be able to do. And so we can learn from that experience because the budget was there, and then seek to how we might grow and expand throughout our organization. And it started there. So just wanted to underscore that point, that it's so important that there's actually resource behind these groups to be able to make an impact.
Yeah, I think that the two things that both of you have talked about is the executive sponsorship. So you've got commitment from senior leadership, and you have the resources to actually execute and implement. It's one thing to have a program in place, but without those two elements, it's often difficult to have them done successfully. So you both were getting into this with the way you approach your employee resource groups and colleague networks. But let's dive a little deeper into this, because for both of you, your workforce isn't a monolith. It's not homogenous. There are lots of different types of diversity in your organizations. But when we look at our data from the Mental Health at Work Index, those organizations that have completed the index, only half say that their workers have access to mental health resources that are tailored to the diverse aspects of their employee populations. So culturally appropriate resources and care, availability in the primary languages that are spoken in the homes, availability of providers that are trained in cultural competency. So beyond your resource groups and your colleague networks, how do you segment your workforce so that you can better understand those specific kinds of needs like you were talking about, whether they're unique risks or disparities or health equity issues? How do you segment them in your particular organization? And why don't we start with you, Beth?
Yeah, so we definitely understand that different backgrounds and also different roles may need different kinds of support, right? So we partner with mental health organizations like Lyra and able to provide those specific resources when they're needed. So an example of that is, our trust and safety team, which spends a lot of time reviewing content and moderating content on the marketplace, can often be exposed to a lot of content that can be distressing, cause stress, cause anxiety. And so we've hosted specific workshops to support those teams of people to make sure that they're getting really specific education around how to manage mental health in their day-to-day role. And then on top of mental health resources, it's also important to couple those with career resources as well. So at Etsy, we provide coaching. And the coaching network that we work with has multiple languages. You can pick coaches that you identify with, that share your identity. And so we really try to work with partners to provide resources that help with all of those intersectional experiences that people are having, because we understand that there's nuance needed to the level of support people can access.
Thanks, Ryan.
Yeah, fantastic examples there. I think many of those things hold true for us too. You know, when we talked about our colleague networks, for example, we talked about the different dimensions of diversity that they represent. So certainly when we think about segmenting our population, there are those. I also talked about structurally just how we're set up in terms of geography and region. And so when we think about segmenting our population, we do it that way. But Beth called out something again that was really critical, and it was around the role and the experience that people have. And so bring that to a healthcare environment. Overall, the field can be one that brings about a heavy emotional toll. And certainly, specific areas are more likely to be exposed to that than others. And so, we consider ways that we can support individuals in specific areas that may be feeling a bit more of that toll, and provide some additional resources around them. One of the unique things in our space is around workplace violence. It is an issue in the healthcare space. And there are certain areas of healthcare facilities, specifically within our hospitals, that are more prone to be recipients of workplace violence. And so there's additional training that we put on for those individuals, both on the prevention side of thinking about what can I do to help de-risk myself from being a part of this situation, but then also in the follow-up, what happens after an event? How do we come to those units and support those individuals there and make sure they have what they need to be able to carry out their work and just be okay after an event like that? And so that experience is one of those pieces for us too that we use to segment the population.
Thanks.
I'll just add one more thing too, Ryan. You sparked this for me, is that there are things specific to the role, and then there are also things that are just happening externally in the world. And I think it's really important that we're also talking about, for managers in particular, how are you providing resources that help them also talk about mental health in the workplace and also help manage stress and anxiety on their teams. So providing a lot of really dedicated resources to people managers is also really critical, because as an organization, we can provide the resources, but how people are accessing them, it's very important that your managers are aware, they're educated, and they have support in how they can have these conversations on the ground with their team members as well.
That's a great point. I mean, not only being equipped with the information they need, but feeling comfortable in having those conversations, and frankly, modeling the behaviors themselves that they want to see in their team. So yeah, I think that manager and supervisor support aspect of that is critical, because they're the people who ultimately probably have the greatest impact on people's day-to-day experience on the job. So we've been talking about representation of various groups and even intersectionality kinds of issues. So representation is an important aspect of this, but ultimately we want to get to inclusion and belonging and engagement so that you can keep people, there's good retention, and that people can thrive and really contribute their best in the organization. In the index findings, 70 to 80% of the organizations that have completed it say they have a DEIB strategic plan. They say they're taking steps to recruit and retain a diverse workforce because it's important to them. But many of them aren't getting the optimal results from those efforts. When we look at those that align their mental health and their DEIB efforts versus those that don't, those that align, 70% said they saw increased employee engagement last year versus less than half of those who don't align those efforts. So that was a really striking finding that we saw in the data. So how do you all go beyond checking the boxes and getting good representation so that people actually feel like they're part of the organization and they're comfortable speaking up, there's good psychological safety, and they can actually contribute and perform at their best? So Ryan, you want to start on that one?
Yeah, a couple of thoughts that really brings to mind. You mentioned belonging. And so when we talk about how we measure within our organization, belonging is one of those measures. That's something that's assessed on our twice yearly engagement survey that we send out. And, that's something that all managers have access to. They can see how they're faring in their specific groups. They can trend that, they can benchmark it against others, and they can action plan around ways to increase belonging within their particular organization. But then you also talked about this piece of psychological safety. And one of the things that really comes to mind there, and I'm really excited about us starting to dive into, is this concept of stigma and just understanding what stigma exists or doesn't within our organization related to mental health. And so this is something that we're starting to dive into now. But generally, what we want to understand is three things. We need to try to define how do we define stigma within HCA Healthcare so we can have a common language and understand what we're talking about. But as we think about that, we want to know how are people feeling generally? Taking a look at depression kind of being the first area that we're assessing. How are our colleagues feeling? And then we want to understand their willingness to be able to disclose if they felt like they were experiencing depression. If they were depressed, what would their willingness be to disclose? But then also from a peer perspective, we want to be able to assess what are the perceptions of our employees of working around others who may be depressed. How are you viewing them in the workplace? Is there a negative perception? Are you viewing them any differently in terms of their ability or how they show up each day? And I think by understanding that, we can decide what actions we may need to take to, again, create this psychologically safe workplace free from stigma. And so I would answer it in those two ways with an emphasis on belonging and all that we can do there, but how we can create this psychologically safe culture by understanding what may be getting in the way.
Yeah, thanks, Ryan. Beth, how do you fully engage people at Etsy and make sure that they feel at home and comfortable fully contributing?
Yeah, I think this topic of psychological safety is such an interesting, deep, and rich, and really complex subject. Psychological safety, many of you might be familiar with the term who are listening. Amy Edmondson coined the term when she was doing research for Project Aristotle through Google. And psychological safety really refers to this idea that it's safe to take some interpersonal risk. And when we're talking about people kind of raising their hand and saying, I need to access mental health resources, I need to take a mental health day, what the company is doing right now in terms of mental health resources and support isn't working for me, that takes a lot of personal risk to be able to do. And so we've spent a lot of time training our managers around psychological safety. So it moves from kind of this buzzword to really being tangible. And what I mean by tangible is there's really 4 stages of psychological safety. The first is inclusion safety. That's just feeling safe to belong, right? You can show up to work and you feel like people want you there. The second stage is learner safety. So you feel safe to learn, to maybe make mistakes, to ask questions. The third is contributor safety. This is the point where you are able to contribute fully and participate. And then the top part of psychological safety, the hardest stage to meet and the hardest to maintain, is challenger safety. And so giving managers this framework to really understand and evaluate, where is my team on this scale? Do we really have challenger safety? How do we measure that and evaluate that? And also understanding that challenger safety is what you need to really challenge the status quo and innovate and create solutions that feel good to everybody. So I think really digging in and providing these resources and tools around how to build psychological safety in a really specific way helps create an environment where people don't just feel like they belong, which is incredibly important, that's foundational, but in addition to belonging, they can learn, they can ask questions, they can contribute, they can challenge. That's really when we start to see the most progress, is when we have that level of safety across the organization.
Thanks. I'm watching the time, and I have about 100 more questions, but I want to make sure we get to some that have been posted in the Q&A box. So I'm going to ask you one more, and then I'm going to jump over to some of those, and then we'll see how much time we have after that. So speaking of challenges, as you were just bringing up, Beth, I want to wrap this part of it up asking, what are some of the biggest challenges that you've faced in this work, and especially in integrating the mental health and the DEIB work in your own organizations? What are the biggest challenges? Have you learned lessons? Have you made missteps where you had to pivot and recalibrate? What can you share that might help others who are going through it? And Beth, why don't we start with you?
Yeah, I think Ryan alluded to this a little bit earlier, that a big challenge in the workplace is still stigma, right? We can have the resources, but if people feel comfortable to take them or to utilize them, that's a completely different story. So I think in addition, as an organization, to measuring engagement, to trying to reduce the stigma by normalizing these conversations, by having leaders model this behavior, you should also pay a lot of attention to if and when people are leveraging the resources. So it's one thing to have the benefit, one thing to have the policy, a completely different thing to see if people are actually using the benefit or accessing the policies. And if you're not measuring that, that is a misstep, because then you're not actually getting a good temperature check of what the culture is in your organization around that stigma of mental health.
Ryan, how about you? Any lessons?
Yeah, Beth and I were kind of chatting before the call around how we're really excited to be in this space because there's still so much work to do. And so I think kind of no matter where we are in this journey, being early on in the journey, one of the lessons was around better collaboration among groups and, initially trying to start some things and provide resources. I think there was a lot of moving that wasn't necessarily coordinated. So that's been a lesson learned to get ahead of that and all be working together to provide the best sorts of resources for our colleagues. That's been the biggest for me. And I would say the other has been not assuming that what works for one area or one population in the organization will work for all. And so by having that realization, I think we've started to make some better progress among that. But those would be the early lessons.
Excellent. Yeah, those are great ones because I think often people want to see something that's successful and sort of lift and lay it somewhere else, something is going to work exactly the same without tailoring it to the unique characteristics of where it's supposed to go. So definitely an important one. There's a question in here for both of you asking what type of EAP support the two of you provide. So Ryan, you want to start?
Yeah, we have EAP through Optum, through our plan. We also have one of the unique benefits, I think, is a specific EAP support for our nurses as well. We have a nurse line specific for them. And so nurses represent a third of our population. Of the 300,000 employees, we have 100,000 nurses within our organization. And so there's a specific nurse line too that's provided on top of that will address any issues that they may be experiencing. But we have a model that allows for several visits throughout the course of the year on different subjects from our EAP, both on-site and virtual.
Thanks. Beth, how about you?
Yeah, we also have EAP through our health insurance provider at Etsy, and we also provide, like I mentioned earlier, we partner with Lyra, which provides free therapy sessions for both yourself and your dependent. And then it goes in network after your first 20 free sessions. And then we also partner with different wellness resources as well to provide additional coaching and support. And then we also provide unlimited mental health and sick days as well.
Thanks. So there are a couple questions in here, and Beth, this is for you, but Ryan, if you have something to add, please feel free to chime in. These are questions related to the psychological safety issue, and a couple of things asking whether there are particular resources or activities that you all have found helpful to use with your team or to provide to managers and supervisors, and are there other tools that have been effectively useful for providing to supervisors to help promote that?
Yeah, there are many amazing resources out around psychological safety. A lot of Amy Edmondson's work is really wonderful. She also, if you look online for her research, she has a survey that you can see it for free online that has questions that help teams understand where they are when it comes to psych safety. Leader Factor is another really great resource that I found. They have a lot of wonderful podcasts out around how to create psychological safety and really challenger safety as well. And then in terms of just like really practical tips, the best way to create psychological safety on a team, one of it is relationship building, of course, and really having managers take the time to build relationships with their teams. But in addition to that, it's almost the best tip I can give is to build dissent or disagreement into processes. So a lot of companies will have something called a post-mortem, which is a great example of you do some type of project together, and then afterwards you talk about all of the ways that it succeeded and all the ways that it failed. Why that's a great example of a psychologically safe environment is because you're assigning people disagreement. So it's not a single person having to raise their hand. It's really a dedicated forum for people to share what went wrong. And you can really take that model and apply it to pretty much any conversation or any survey or question ask kind of scenario in your workplace. A really easy example is in your benefits survey, or even if you're just asking for feedback around your mental health programs, instead of saying, is there anything that you would improve, which is a very open-ended question, you can say, what are specific things that aren't working, or what are specific gaps that you're experiencing in this moment when accessing mental health support? And that's a way, again, of building in that ability to disagree in a way where it doesn't take on a ton of individual risk for somebody to raise their hand and give that feedback. I hope that that was helpful. If that didn't answer your question, please let me know.
Yeah, thanks, Beth. Ryan, anything you want to add on the psychological safety front?
Sure, I'll add three quick thoughts, and I think it's such an important conversation because our managers are being asked to support their teams in ways that just haven't been taught historically. So there are three things that come to mind. The first is an internally developed program that we created called Thrive Forward for Managers that specifically teaches managers how to take care of their own needs, but then also check in on the needs and support their teams in a very practical way. So that's one that I think about. The other is we do employee rounding on all of our employees. And so now there is a rounding template that's used to help managers have conversations with their teams to check in on various things. And since August, actually, we've added a question in there for them to check in on the safety and well-being of their teams and find out if there's any concerns there or anything that they could be doing to help. And then the third, I mentioned before that having that budget from a colleague network or an ERG perspective is so important. What we're piloting there that we hope to be able to expand as this pilot wraps and we see the results is this sort of peer support called Mental Health Ally that we're working with now. And so based off of the results of that, it's really teaching lay people, non-mental health professionals in the workplace to be that support for others who may come to them. And so we're excited about seeing what the results there are as well. So I think those three things have really been tools to help empower some of our managers.
Yeah, I think it was a really good point about having the structure and reminders in there. I think, until something gets ingrained and becomes just part of the way you do things on a team or as a manager, sometimes it just takes that pop-up, that reminder, building it into a structured process so that it happens until it becomes routine. So yeah, good point on that front. Next question has to do with the fact that there's been some pushback related to DEIB recently, and there's some people who are increasingly cynical about it, saying that, oh, this creates division, it increases divisiveness in an organization, which is the opposite of what this is supposed to do. So how do you make sure that in your organizations that DEI initiatives lead to enhanced belonging and not separate people out? So Ryan, you want to start?
That is a fantastic question there on how we do that. For us, I'll say two things. One, I started out talking about this being just part of the core of who we are and tightly tied to the mission of the organization. And so that's really what leads the way. We heavily focus on belonging within our organization, but a really important piece of that is understanding by creating that right kind of culture within our workplace, we better carry out our job, which better serves our patients and our communities. And we know that having representation in those communities and having folks who feel like a part of this organization delivers better outcomes. And so there's not really space for us to allow those sorts of conversations to get in the way of really important work that we're called to do. And so it's not to say that, in facets, conversations never pop up. I'm sure within any organization they might, but really we're led by that mission, and that's what carries the way for us to deliver that care to our patients.
Thanks, Ryan. Beth?
Yeah, the DEI mission at Etsy, DEI is really part of our DNA, Ryan. As you said, it's part of who we are. It's embedded into everything. And the mission that we serve is to create equitable access to opportunity for employment, engagement, and development for everybody. And when you boil it down, diversity is a fact, right? It's all of us. It's all of the unique experiences and backgrounds that we bring to the workplace. Equity is intentional. It's how we create equitable access for everyone across the organization. And inclusion is an outcome of that, right? It's how people experience the feeling of belonging on our teams. Everyone deserves to feel that sense of belonging, and everyone should have the same access to growth, development, and engagement. So that's what guides our work, and that's really not political.
Yeah, it's unfortunate that some people are using this issue that's meant to bring people together and are using it in a politicized way to divide people. Because you're right, it's not a political issue; it's a people issue, it's a business issue, and it's just reality. And if we want to be successful moving forward, I have a question about tech platforms because you both have employee resource groups, colleague networks, but increasingly people work in different locations or they have hybrid work versus on-site versus at home. So what tech platforms or tools do you use to help reach every employee, regardless of their work arrangement, to drive these efforts and connect them to groups like your ERGs? Beth, you want to start?
Yeah, sure. So first I would say, Etsy is a very Slack heavy company. So we try to meet people where they are in terms of communication. So a combination of what we see people are leveraging in terms of how they access information, it tends to be people prefer it on Slack. So we usually do a combination of Slack and email. We also include information about our employee resource groups and all of our benefits in our new hire orientation. So it's really part of your onboarding to understand what resources there are and how to access the communities that we have. And then Etsy also has something called Prime Time. And Prime Time is something that we created as a way of really developing an inclusive time zone, considering all of the places where we operate across the globe. And so our Prime Time occurs during specific hours during the day. And that's when we tend to plan our employee resource group events to be as inclusive as possible during the prime time hours, and also usually only on Tuesdays, Wednesdays, or Thursdays to account for shift workers who might might not be working on like a Monday or a Friday. So we really have built that into our processes when we think about how to develop the strategy. And then we also are quite hybrid. And what I mean by that is when we have events, we either have an event where there's an option in a local office, in each office where we have employees, and a virtual option, or the event itself is virtual first. So we really try to make sure we're as inclusive as possible with how we're planning and scheduling and communicating.
Thanks. And Ryan, you've got people in lots of different locations and out in the field. How do you handle this tech-wise?
Yeah, here's where that local leadership and local structure is so important because, I appreciate the comment around time zones. I mean, thinking about something as simple as that, it really does take some individual catering to different groups because of that. We have many of the same sorts of tools that Beth mentioned in terms of our instant messenger services. We use our intranet site. We, have email, other ways that we push out messages to our folks. But some of the more traditional things are also really helpful for us, less on the tech side, home mailings in terms of getting information out. A large number of our employees are sitting at the bedside and are not on a computer. And so we've got to use human channels, managers talking with teams, huddle cards that sit in a break room, all of those sorts of things to make sure that we're reaching folks as well as mobile too. But some of those more traditional communication methods are really important for us to get to all of our colleagues.
Yeah, that's a good point. We forget about those. I mean, we're so tech heavy and tech oriented these days that we forget sometimes those concrete physical things matter and are sometimes the easiest way to get somebody's attention. So we're hitting up against the end of our time. So I'm going to throw you one last question in a lightning round. So in 30 seconds or less, if there's an organization who's just getting started integrating these efforts, so they maybe have programs at various stages of development on the mental health front, the DEIB front, but they haven't integrated them at all, where should they start? Ryan?
Boy, from our lessons learned, I would say cross-functionally early on, more collaborative, the better. And then the other thing that I would add to is get a sense of why you're doing this and start measuring now. Understand what outcomes you want to measure and begin to do that as early as you possibly can. I think that's a great place to start.
And under the 30 seconds, I'm impressed, Ryan. Beth?
Yeah, I would plus one, Ryan, to what you said about measurement. I think that's really important. And also just get a sense of where people are. Spend time listening, really talk to your employee base and get to know where people think the priorities are. So you're not sort of prioritizing in a vacuum, right? You're able to understand what the gaps people experiencing are, and that will help you prioritize a plan and a roadmap going forward.
Excellent. We could continue this conversation forever. There's so much more that we could talk about. I'm going to go back to the political issue with a quote just to wrap things up. And it's a quote from Reverend Jesse Jackson, who once said, "Inclusion is not a matter of political correctness. It's the key to growth." So I hope we've planted some seeds today about how thinking holistically about workforce mental health and DEIB can produce better results on both of those fronts, and also create a healthy, high-performing work environment where everybody is able to be there, feel part of the team, and bring their best work-wise. So I want to thank you, Ryan, Beth, for spending time with us today and sharing the fantastic things that you're doing. I hope we can continue this conversation. For those of you who've joined us in the next few days, we're going to be sending out a summary of our discussion today and a recording of this webinar. Please share this with others in your network. We want to distribute this and get this in front of as many people as possible. And I'm also pleased to note that in celebration of World Mental Health Day that was last week, for a limited time, we're going to be offering a 50% discount on the Mental Health at Work Index. So you can go to mentalhealthindex.org, or you can email mentalhealthindex@onemind.org to learn more about that. So with that, Beth, Ryan, thanks very much. And for all, be well.